Efforts to rebound across Kentucky and Tennessee will take time, and News Channel 5 is dedicated to keeping you informed and connected every step of the way. As we move towards reopening, addiction treatment providers need help themselves. News Channel 5's Matthew Torres explains how complications are keeping them down.
Our women are being laid off repeatedly.
Katrina Frierson of Mending Hearts has been helping indigent women battle their addiction. But lately, she's tackling a whole new set of issues.
We're thinking that we are already in an epidemic with addiction and mental health issues. And now we have a double effect of it.
COVID-19 is forcing her nonprofit to go over budget to buy supplies and keep more than 100 women and staff safe, even as revenue goes down.
We don't know what the next 3 to 6, 9 months look like. So people really want to hold on to their funding.
She expects to be in the red by the end of June as major donors opt out during this unstable economy. Mending Hearts already had to cut workload and lay off a couple of employees at a time when some women had to be in isolation.
We still have to man that with staff that we don't have a contract or dollars to support that staff for taking care of these participants.
And some of those same concerns were listed in a letter sent to Congress this week, urging for more help. The letter sent by the Tennessee Association of Alcohol, Drug, and Other Addiction Services says if funding continues to lack, more people could die of an overdose. The executive director says other providers are at risk of closing because the number of people seeking treatment is down. The letter also cites lack of personal protective equipment as a problem, saying several agencies never received equipment despite sending requests to the state. Some have yet to receive the full order, including Mending Hearts.
Due to shipment, we don't blame it on the state. It's just getting the supplies to the state and getting them to the agencies.
However, the roles are still essential, even if the war against the virus makes the war against drugs harder.
We have to keep fighting the fight.
Matthew Torres, News Channel 5.
Mending Hearts is now receiving help through an SBA loan of $200,000. The state says TAADAS's letter is not representative of the vast majority of state contracted providers receiving PPE and that it has worked to make sure providers have the equipment. TAADAS has both state-funded and private organizations as members.